Okay, you're good.
Alright, so for my presentation, I'm going to be talking about our research title, Effectiveness of Manual Physical Therapy and Exercise in Osteoarthritis in the Knee. Some general information is that it was conducted in 2000 by Dale et al. It's a group of 7 different researchers, and you can find it on ACP journals. Why I chose this research is because I personally have suffered with multiple traumatic knee injuries that have required surgery on both my knees, and as recently as last year was my last surgery. So I thought, because of this, I have a much higher chance of developing arthritis in my knees. So I figured to research this and see if maybe manual physical therapy would be something that I could do to help. The main question that this research tries to ask is whether or not manual physical therapy can help reduce the severity of osteoarthritis. An important note about this is that the research is not trying to find a cure for osteoarthritis, because there is no cure. It's just trying to see if manual physical therapy can be a viable option to help treat it. The general setup and how the procedure was done is there was 83 patients divided into a control group and a placebo group. All patients had to range within 50 to 70 years old and have suffered with chronic knee pain and stiffness, of course, as well as arthritis. The research took place over the course of 8 weeks, where each patient needed to check in every 2 weeks and do their routine, as well as a 6-minute walk test. The 6-minute walk test is just seeing how far you can walk in 6 minutes. It was kind of the researcher's way of gauging progress and how far along each person is. The techniques that were used were that the control group received manual physical therapy that aimed at stretching the muscles, soft tissue mobilization, and range of motion improvement, as well as supervised exercise by physical therapists to help stabilize the muscles and just kind of help overall muscle growth in the leg. And on top of this, the control group also received an at-home regimen of workouts to do when they're not at the clinic. On the other hand, the placebo group got essentially nothing. All they got was a sub-therapeutic ultrasound for 10 minutes every 2 weeks. So this difference led to a really profound difference in results, where the control group reported a lot less pain at the end of the 8 weeks, as well as performed significantly better in the 6-minute walk test. And in my opinion, the most beneficial and important win that the control group got was that they actually had less surgeries in the years following the research. And for example, if you guys are wondering how much better the control group did than the placebo group at the 6-minute walk test, the control group averaged a score of 599 in the final test, and the placebo group averaged a score of 170. So it's a big difference. The research concluded that manual physical therapy is a very viable and effective option to treat arthritis in the knee. And some way that I could take the research the results of the research into my personal life is to just stay with the physical therapy that I'm currently in right now, and just keep taking it seriously, and maybe even to give manual physical therapy a shot. To be honest, the results didn't really surprise me, as I was kind of expecting it, because I personally go to physical therapy and I know how much it helps with recovery of the knee. And I can only imagine how much it would help an older individual who isn't able to be as active as they once were. A suggestion that I would give if I were doing the research, or if it was being conducted today, would be to give the placebo group a little more, maybe a therapeutic level of ultrasound, just so that way you can kind of compare and contrast each method of treatment and see which one's better, and maybe you can even combine the two to make one really effective method to treat osteoarthritis. That's it. Thank you.